In the world of medical science, consent is not just a formality, it's a fundamental ethical principle. It ensures that every individual retains autonomy over their own body and medical decisions. In this video, we'll explore what consent means in medical science, its different types, and why it's essential for both patients and healthcare providers. Consent in medical science is an agreement between a patient and healthcare provider before any medical intervention, be it diagnosis, treatment, or research. It ensures that the patient fully understands the procedure, is aware of potential risks and benefits, has the freedom to accept or decline the proposed intervention without coercion. Consent is deeply rooted in the ethical principle of autonomy, the right of individuals to make decisions about their own lives and bodies. Types of consent. 1. Informed consent. This is the cornerstone of ethical medical practice. Informed consent involves clear communication about the nature of the medical procedure, risks and potential complications, alternative options, including the choice of no treatment. Example: before undergoing surgery, a patient signs a consent form after a detailed discussion with their surgeon. 2. Implied consent. Often used in emergency situations where explicit consent cannot be obtained. Example: a patient arrives unconscious in the ER after an accident. Medical professionals act to save their life based on implied consent. 3. Explicit consent. A direct, clear agreement, either verbal or written. Example: a patient verbally agreeing to receive a vaccine or signing a form for participating in a research study. 4. Proxy consent. When patients are unable to give consent, e.g., minors or individuals with impaired decision-making capacity, a legal guardian or designated proxy provides consent on their behalf. Why consent matters. Scene: doctor talking compassionately with a patient, ensuring mutual understanding. Patient autonomy: respecting a patient's choices fosters trust and empowers them to take control of their health. Legal protection: consent protects both the patient and the healthcare provider from potential legal disputes. Ethical integrity: it ensures that healthcare remains a partnership, not an imposition. Challenges in obtaining consent. Visuals: a montage of doctors interacting with diverse patients. Language barriers: miscommunication due to linguistic differences. Medical jargon: patients might not understand complex terms, leading to incomplete understanding. Coercion or pressure: external factors, such as family influence, can sometimes compromise true consent. Consent in medical research. Scene: researchers in a lab and patients reviewing forms. In research, consent is equally critical. Participants must be informed about the purpose of the study, potential risks and benefits, their right to withdraw at any time without consequences. Famous cases like the Tuskegee syphilis study and the Henrietta Lacks case highlight the catastrophic consequences of neglecting informed consent in research. Islamic perspective on consent. In Islam, the sanctity of human life and personal autonomy are paramount. Islamic teachings emphasize that no one can harm or interfere with another's body without their permission. This aligns with the principle of consent in medical ethics, reinforcing the importance of mutual agreement and respect. Consent is more than a signature on a form, it's a bridge of trust between healthcare providers and patients. It ensures dignity, respect, and ethical integrity in every interaction. By understanding and upholding the principles of consent, we can make medical science safer, fairer, and more compassionate. Thank you for watching. If you found this video insightful, don't forget to like, share, and subscribe to stay updated with more health and wellness content.